everyone, and thank you for tuning in. In this episode, Dr. Jonette Keri will share some highlights and clinical pearls regarding new medications for preteen acne. Thank you so much for being with us, Dr. Keri.
Thank you, Lindsay. Happy to be here.
What is your personal approach to treating acne in preteen patients compared to other age groups?
Well, what you want to realize when you take care of preteen patients, they're really little people, and they think very similarly to us, but you have to be able to connect with them. So one of the things I always do with my preteen patients is I do use a pediatric trick, which is I sit on the stool. I don't stand, and I stand in my clinic a lot. But with preteen patients, I want to get down to their level, and then I want to see what's bothering them. I want to speak to the patient more than I speak to the parent, although we bring the parent in. I want to speak to them and make that comfort level. And then I want to think of things that they will like using and try to gain their confidence.
What is your advice for dermatologists to keep in mind when treating preteen patients with acne?
So you want to know what you can use. There are a lot of things that we can use out there that people are afraid to use, but you also want to make it simple. So for me, I generally like, for example, a wash. I always try to incorporate a wash because washes are easy for all of us, and they're particularly easy for the preteen patient. So I like to incorporate a wash that has some medication in it. And then I look for ways that they will be able to use another product. So a lot of time, nighttime is a good time. Children and preteens sometimes have trouble getting up in the morning, and to have them use something in the morning and night is a little difficult for them. Now, some are motivated and some will do it, but in general, I try to pick a wash and then something to use in the evening before they go to bed.
Can you tell us more about the efficacy and safety of these new acne medications for children and adolescents?
Sure. So we have a lot of new medications, which we haven't had for a while. Let's talk first about a new oral antibiotic called sarecycline. Sarecycline is a weight-based antibiotic. It's about 1.5 milligrams per kilogram, and it is a once daily, which is great for the preteen population. The other thing that's good about it, it is something that does not create as much antibacterial resistance. But for the preteen population, that may be only of concern to their parent. For the child taking it, they like things that are once a day. That's easy. The other thing that's good about this medication is the side effect profile is low. So generally, they should be able to tolerate it very easily. It's once a day pill. It's for ages 9 and up, which is wonderful because we do have children with significant acne from 9 and up. So I like sarecycline for that reason. In addition to this new oral medication, we also have some new topicals. And one of the new topicals that is approved for the age of 9 and up is something called trifarotene. And trifarotene, we're really excited about because this medication, in the studies that were presented, seems to act a little quickly. We might see improvement as soon as 1 week on the face and as soon as 2 weeks on the trunk. So if you think about that, everybody wants everything nowadays quickly. And it's not just the kids, adults want it too. So in that setting, if we can give them something that they start to see improvement early on, they're more likely to stick with it. So we like trifarotene, again, once a day. It's a new retinoid. So it's in the same class that we've been using for years, the retinoids, but it is new. So we like the idea that we have something that works quickly that's once a day. In addition to trifarotene, we have a new topical antibiotic, and that's minocycline foam. So minocycline foam 4% is a once a day antibiotic. Again, doesn't seem to create resistance, seems to be something that is good for the parents that are concerned about that. But what I like about minocycline foam is that if you look at it, it's a little bit yellow, but it's a fun product. And a lot of times I give it to my preteen boys because it's a little bit of it's a mousse, it's a foam, and it comes out, and we tell them to use about the size of a plain M&M on their entire face. So it's something that they can understand. It's easily accessible. They like the consistency of a foam. So they use it once a day and they like it. And the results are good with all the products that I've discussed about the efficacy. They're good. They're right up there with all the other acne medicines, and the ease of use of the things that I've just spoken about is wonderful for the preteen patient. Now, we don't want to forget about some of our products that have been around for a little bit of time. And these were all geared at making it easier for the patient. And there are some new topical tazarotene and topical tretinoins that are in lotion form that are less irritating. Because remember, if I don't like it, and I'm not going to use it, and if a preteen doesn't like it, they're not going to use it. So these are less irritating topical retinoids that are a little older. We've had them around a little bit longer, but they show good efficacy in that preteen age group. So those are the things that I have wanted to clue people in about from the ages of 9 and up. We have another product coming down the road, which is already FDA approved, which is called clascoterone. And clascoterone is a topical anti-androgen. So it's a brand new medication in the world of acne and treating acne. So clascoterone's FDA approved. It will be approved for the ages of 12 and up. So still preteen, but a little bit older age group. And it should be coming out soon. I haven't seen it being available yet, but I know that it has been FDA approved. So those are all the new products that we have in our armamentarium for preteen acne, but we can't forget about the oldies and goodies. And those include good washes that we have available with benzoyl peroxide and glycolic acid and salicylic acid. So when considering all these medications, they're all efficacious. They have a very good safety profile. And I always add the oldies and goodies because a lot of times those are less expensive and good for patients who can't afford the products that I just spoke about.
Thank you. And final question, how do you educate patients and families to deal with the psychological aspects of acne as well as the treatment adherence?
So before we got on today, Lindsay, I was getting ready and putting some cream on my face that didn't burn my face and supposedly is an anti-ager. So I thought I'm no different from the preteens I'm going to talk about today. They want something that's easy to use, that doesn't irritate their skin, and that they see results. So if we can get all that together in a product, then we can improve adherence. So when I think about adherence in preteen populations, I think something that they're going to see a result fairly quickly. And we have to educate them about what fairly quickly is. It's not a week or two, even though that one product is showing that. The acne studies are done at 12 weeks. And most preteens and most adults aren't going to wait 12 weeks. But we start to see improvement around 4 to 6 weeks. And we can tell them, give it 4 to 6 weeks, give them a timeline, give it a month, and you should start to see improvement. But they have to like the way it feels on their skin. They have to not be bothered by it. And then that will improve adherence. With the parents, they have to be on board with the child, but I've had parents who have put the medication on the child. And I think except in special in situations where the child may need help, I think that at this point in their lives, they can start doing that them by themselves, and we should educate the parents to encourage them to do it, but not do it for them, except again in special circumstances where they may need help. So I think that educating the parent, picking the right products, educating the child, getting down on their level and educating the child and developing that confidence, and then bring them back and take a look at them. And you'll be able to move forward in the treatment of the preteen acne, with the goal always being that we want the child to feel good about themselves, that we want them to have good self-esteem. And from a physical standpoint, we want to prevent scarring because they will scar even at this early young age.
Thank you so much, Dr. Keri, for sharing your insight with us today. We appreciate you and your time.
You're very welcome, Lindsay. Thank you so much for this opportunity, and my best to all of you.
Thank you. And thank you to all of our listeners. And until next time.